Welcome, everybody. I'm really pleased to be here with you today to present our Portuguese and English webinar on diabetes and COVID-19. I'm Kimberley Hanson, I'm Executive Director at Diabetes Canada, and I'm really excited to talk to you about supports that you might access during this extraordinary time of this pandemic, both for yourself sort of as a citizen, as well as someone living with diabetes. How can you access care and take care of yourself while we're at home? I'm really thrilled to be joined today by Member of Parliament for Davenport, Julie Dzerowicz, and by a healthcare provider, Maira Perotto, who is a registered dietitian with the West Toronto Diabetes Education Program at the LAMP Community Health Center. I'm also joined by my colleague, Renan Passatore, who works with me at Diabetes Canada and has kindly offered to do some translation for us today. So welcome, everyone. Thank you so much for being here.
Olá a todos.
Olá, boa tarde to everyone, and thanks for inviting me to join you today, Kim.
My pleasure. We'll be offering our remarks today in both Portuguese and English, as I mentioned. And just a few housekeeping things before we get started. We're going to be answering some questions that MP Dzerowicz has heard from some of her constituents, that we at Diabetes Canada are hearing from some of our constituents, and we'll also be taking questions from our live viewers. So if you're participating in Zoom, you can add your comments in the Q&A function. If you're participating on Facebook, feel free to add your questions or comments in the comments section. Just for your information, we are recording this session and Diabetes Canada will make it available on our YouTube channel for anyone to view after the fact. You can share it with any of your community who might be interested. So I'll ask my colleague Renan to just repeat what I said. Then we're going to do a really quick poll of our viewers to make sure that we understand what your learning needs are and how we can best meet them today. And then we'll get started. So Renan, over to you.
Olá a todos, sejam muito bem-vindos. Meu nome é Kimberley Hanson e eu sou diretora executiva do Diabetes Canada. Hoje nós vamos falar um pouquinho sobre aqueles que vivem com diabetes ou pré-diabetes e como eles podem gerenciar e encontrar apoio durante essa pandemia sobre o coronavírus também. Bom, aqui comigo eu tenho a nossa membro do parlamento para Davenport Neighborhood, vizinhança, Julie. Eu também tenho a médica Maira Perotto, e eu também tenho aqui que ela é nutricionista do distrito oeste de Toronto para a educação da Community Health Center, que é uma comunidade de saúde da neighborhood. E em Toronto eu tenho o meu amigo Renan, que também trabalha no Diabetes Canada, que gentilmente concordou em traduzir todo este webinar para mim em português para poder ajudar vocês. Oferecemos a apresentação, como eu disse, em inglês e em português. Hoje, nossos especialistas irão responder algumas perguntas e vocês podem participar enviando-as pelo Facebook, se você está assistindo, na parte dos comentários, ou então pelo Zoom, na parte de chat ou de conversa, tá bom? Nós também temos a alegria de ter hoje a nossa MP, Julie, para começar conosco hoje. Ela vai estar conversando alguma coisa sobre o que ela tem ouvido dos eleitores e nós, como da comunidade do Diabetes Canada, nós também estaremos conversando um pouco sobre o que nós temos ouvido sobre as pessoas que vivem com diabetes ou pré-diabetes aqui no Canadá.
Thank you, Renan. So Raquel, maybe we can have our poll quickly and then we'll turn it over to MP Dzerowicz.
Thank you.
So would you like to know more during our session about the relationship between COVID-19 and diabetes, how you can access healthcare during the pandemic, or how you can access financial supports for living with diabetes during the pandemic? So I'm afraid we're forcing you to choose one. You'll get a bit of all three, but your answers will help us emphasize and expand on some of our remarks during the session. So please just take a quick minute to answer that question.
I'm not able to.
We don't get to vote.
A pergunta que está aparecendo hoje é para você poder selecionar o que você gostaria de saber sobre hoje, sobre o nosso webinar de hoje. A primeira resposta é o relacionamento entre o COVID-19 e diabetes. A segunda é como você pode ter acesso ao healthcare, ao sistema de saúde durante a pandemia. E a terceira opção é como você pode ter acesso financeiro durante essa pandemia, perdão.
Okay, fantastic. So we got sort of a split result. All three of those are of interest, so that's great. We will tackle each of those questions during this session. So let's start with MP Dzerowicz. Diabetes is a large burden in Canada. 1 in 3 Canadians now lives with either diabetes or prediabetes, and it can be quite costly for people to live with. So can you talk to us about what our government is doing to respond to COVID-19 and particularly to help Canadians with some of the financial sting of this pandemic?
Great. Thank you so much for the question, Kim. And I just want to first say a warm welcome to everyone who's joining us today and anyone who might be watching us in the future. I think this is an extraordinarily important conversation. Kim, I want to thank you for your leadership at Diabetes Canada. I want to thank Maira for joining us in terms of our health expert. And I want to thank Renan, who's got a very tough job in terms of trying to translate us as best as he possibly can. So I will tell you that diabetes is very important. It is an issue that's been raised at the national level. So I'm the member of parliament, so I work at the federal level with our Prime Minister, Justin Trudeau, and an amazing group of liberal, elected liberal members. Diabetes is a top issue. My colleague, Sonia Sidhu, who's the member of parliament for Brampton South, is our biggest champion, okay? And she's been the person that's actually really put diabetes front and center for the federal government. One of the key things that we've done is we've actually designated November as Diabetes Awareness Month. And it's extraordinarily important for us to do for all the reasons that you had mentioned, Kim, and the ones that we're going to be talking about, how prevalent this disease is and how important, whether it's pre-diabetic or in the diabetic stage, that we actually help people to live as full a life and as healthy a life as possible. The other thing that we've done at the federal level is we are very big supporters of a national pharmacare program. So right now we've been delayed a little bit in terms of our work on it simply because of the pandemic that's underway. But I want all Canadians to know, and everybody listening, that having a pharmacare where our medications are covered nationally is very important to our federal government. So we've taken a number of steps to start putting in the key tools, the key foundational tools to have a national pharmacare set up. We do have some work to do primarily with the provinces to set up how we're going to deliver it to each of our provinces. So that's the big work that's ahead, but please note that that is a big priority for us. I want to say to you, because I'm very blessed in my riding of Davenport, I have a huge Portuguese population, but I also have a huge Brazilian population. And they're just two of a huge multi-ethnic grouping that I have here. But I do want to target a little bit the Portuguese population right now. We are now it's June, so it's Portugal Heritage Month, and food is a core part of the culture. It is huge. Every event I go to, food is front and center. And so, us talking about food, us talking about how to stay healthy is very important today. And so I just want to say in terms of, I just want to say that I think it's an important discussion for us to have now. I will mention, because I think it's important, we are going through the 12th week. So we're ending the 12th week of our COVID-19 lockdown. I want to make sure that everyone that's listening know that there's a lot of supports that are available for Canadians who might need some additional emergency support. So whether you're a senior, whether you are a worker that's out of work, whether you have some mental health issues, whether you need some additional supports from your community organizations, there's a lot that's available. And I ask you to go visit canada.ca/coronavirus. So that is our main page that gives you you know, what help is there in terms of for your health? What help is there if you are an individual that's out of work? What help is there if you're a small business that's needing some additional support? So make sure that you go to, so it's canada.ca/coronavirus. And if you don't know what benefits you might actually be eligible for, there's also canada.ca/coronavirus benefits. So that's plural. And it's a little online tool, and you answer a few questions and it gives you a full list of what you're eligible for. So I just felt that that was important for us to mention. And Kim, thank you for the patience for allowing me to do that. But I think people are so stressed at this time, and anything we can do to provide information that will alleviate their stress is also going to be helpful for their health as well. And I will tell people, as much as many organizations, because a lot of our community centers in Davenport actually offer support around diabetes. And so many of them, they're physically closed to the public, but they're still providing services either online or by telephone. So I want to make sure people know that that's still available to them. And they just have to call their local organization up and say, hey, what's available? And they'll be able to provide that. And also they can just call me at my office at 416-654-8048. And we're also happy to be able to relay to that. So I just want to say thanks to you. I haven't gone through the statistics of how big diabetes is. You know, the fact that it's, you know, cost our healthcare system $30 million to actually treat, that it's the leading cause of heart disease, stroke, heart failure, blindness, and amputation, that it disproportionately impacts vulnerable Canadians, especially our seniors, as well as our low income earners. And despite the fact that we have an excellent healthcare system here in Canada, we still don't do enough, in my opinion, to treat diabetes. We have a long way to go, and that's why for me, I feel very lucky to have the chance, Kim, to be able to have this conversation with you today. And I want to thank you again for your excellent leadership. It's an important conversation, and I know many in my community are impacted by this disease. So thank you.
Well, thank you, MP Dzerowicz. And I think all Canadians feel so grateful right now for what you and other leaders in our government are doing to help us navigate this incredible time that we're living through. And so thank you for all of the programs and the commitment that the government has to making sure that we all come through this as healthfully as possible. It's really appreciated. Renan, could I ask you to take a minute to repeat some of the great tools that MP Dzerowicz has referred to?
Sure. Eu gostaria de garantir a todos que o nosso governo ele está muito empenhado e focado no combate a ajudar as pessoas que têm diabetes, principalmente nesse tempo de pandemia. O governo federal, ele tem se empenhado muito em poder ajudar e garantir que todos recebam os medicamentos necessários durante essa pandemia. E nós sabemos que é um pouco difícil para muitos, porque alguns perderam o emprego ou estão ou temporariamente afastados. E eu gostaria de, então, de avisar vocês que o nosso governo e eu, como trabalhando com o nosso primeiro-ministro, Justin Trudeau, nós temos feito um trabalho bem focado em ajudar as pessoas com diabetes ou pré-diabetes. Eu também gostaria de focar um pouco na comunidade portuguesa, a comunidade que eu também faço parte na área de Davenport, onde eu represento eles. É uma comunidade que tem uma representatividade portuguesa de Portugal e também brasileira, de pessoas que vieram do Brasil. Essa comunidade, eu gostaria de falar que nós estamos comemorando esse mês como o mês de Portugal aqui no Canadá, e nós sabemos que a comida faz boa parte da nossa cultura portuguesa. Então, eu gostaria de lembrar a vocês que é muito importante que nós estejamos bem atentos com o que está acontecendo, e eu gostaria de confirmar que os nossos centros comunitários daqui da área de Davenport, eles estão oferecendo suporte para vocês. Se vocês precisam de algum suporte financeiro ou se você tem alguma dúvida referente a diabetes, você pode entrar em contato conosco, pode procurar algum dos nossos centros comunitários ou então ligar para o meu escritório.
Thank you, Renan, very much. Now I'd like to welcome Maira Perotto. Maira, people who live with diabetes are wondering whether they're at greater risk of greater risk to COVID-19 because they live with prediabetes or diabetes, what would you tell them?
So good afternoon, everyone, and thank you, Kim, and thank you, Diabetes Canada, for the opportunity to be here today. Also, hello to my fellow webinar participants, Sabrina and Julie Dzerowicz. I work in the Davenport area, so I'm very familiar with your work. And yeah, so I work at one of the sites where I work is the Davenport Neighborhood and Community Health Center. So we have been very active serving our community during the COVID pandemic. Regarding the question around risk of COVID-19 and people with diabetes, what we know from the studies that are currently available, again, it's important to keep in mind that the coronavirus is a new virus. So we are still trying to understand its behavior in more detail and how it affects different communities, different community groups and people with different conditions. But as far as we know at this point, it doesn't seem like people with diabetes are at higher risk of getting COVID-19. However, if they do become infected with COVID-19, they are at higher risk of having a more severe infection. So in other words, becoming more severely ill from the coronavirus. So what this means is that people with diabetes are at higher risk of developing complications such as pneumonia, and they're also at higher risk of requiring hospitalization and potentially intensive care. So knowing about this increased risk of a more severe form of the coronavirus infection, it's important to all people, but in particular people with diabetes and those living with people with diabetes, to practice all the public health measures that help to reduce the risk of COVID-19 transmission, so things like washing your hands properly, practicing physical distancing, so staying 2 meters away from people not living with you in your household, and wearing a mask when you go out to reduce the risk of the virus. And so in addition to that, there are also the diabetes self-management behaviors that we always emphasize. So things like, keeping your blood sugars in good control as much as possible given the circumstances. We know that stress is one of the factors that affects blood sugar, so it's important to keep monitoring those blood sugars, continuing to monitor your blood pressure using a home blood pressure monitor if needed, eating as healthily as possible, taking their medications consistently, and making any required adjustments based on any changes in physical activity levels, as advised by your healthcare team, of course. And also doing things that help us to stay well in general. So getting a little bit of exercise, so yoga or walking if it's safe for you to keep, again, that 2 meter distance from others, and just staying connected with people and looking for information that's helpful, that's accurate, and that's up to date. In that regard, Diabetes Canada has been a wonderful resource that I've been using for myself as a professional and also with my clients. So accessing the Diabetes Canada website for their FAQ, there's a specific section of the website for COVID-19, and there are updates there. There's a frequently asked questions section. And if someone has questions about their diabetes specifically, there's a channel of communication, so a direct channel that they can access with Diabetes Canada. So they can call the Diabetes Canada 1-800 number. So it's 1-800-BANTING, so BANTING, and they can speak with a certified diabetes educator. So they submit their question, and then an educator will get back to them in 24 hours. So that's a wonderful resource for many people with diabetes and their loved ones.
Thank you, Maira. That's wonderful advice and great tips that you've given. Perhaps you would repeat that in Portuguese, and then I've already got a bunch of questions for both of you.
Ok, great. Agora eu vou falar em português. Então, boa tarde a todos e obrigada ao Diabetes Canadá pela oportunidade de estar aqui conversando sobre o coronavírus e o risco para pessoas que têm diabetes. Gostaria também de dizer boa tarde para os meus colegas que estão participando do webinar, o Renan e a Julie. E o que eu quero dizer em relação ao risco é que o que nós sabemos até o momento sobre o coronavírus é que não existe um risco maior de pessoas com diabetes de pegarem o vírus, mas uma vez infectados com o coronavírus, as pessoas com diabetes têm um risco maior de desenvolver um quadro mais severo da doença. Então, possivelmente desenvolvendo complicações como pneumonia ou precisando de hospitalização e possivelmente também terapia intensiva em hospital. Então, sabendo desses riscos maiores da severidade da doença afetar pessoas com diabetes, é extremamente importante que elas continuem a praticar todas as recomendações de saúde pública que diminuem o risco de transmissão do vírus, né? Que são, então, a lavagem adequada das mãos, ou o uso do álcool gel, se não for possível lavar as mãos, manter a distância de 2 metros de pessoas que não vivem com você e usar uma máscara quando você sai, de novo, para reduzir para reduzir o risco de transmissão do vírus, né? E, além disso, os comportamentos que fazem parte do controle do diabetes, como o controle dos açúcares, o controle da pressão, fazer alguma atividade física, tomar os medicamentos da maneira prescrita e fazendo os ajustes conforme orientados pela sua equipe de saúde, caso o seu nível de atividade física seja menor durante a pandemia por motivos de isolamento social. Se você tiver mais perguntas, é importante buscar fontes confiáveis de informação. Então, o site do Diabetes Canadá é uma excelente fonte de informações atualizadas e também informações que têm uma muito maior credibilidade do que outras fontes que estão disponíveis na internet, que a gente não tem certeza se são realmente baseadas em evidências científicas. Se você tiver perguntas que você queira esclarecer, existe um canal, existe o site do Diabetes Canadá, diabetes.ca, ou então um número 1-800-BANTING, B-A-N-T-I-N-G, e você pode ter acesso a uma pessoa que trabalha com diabetes e que pode responder as suas perguntas dentro de 24 horas. Over to you, Kim.
Wonderful. Thank you so much, Maira. So one question that we've had, it's one I can relate to. I live with type 1, and one of our viewers is wondering whether people with specifically type 1 diabetes are at any greater risk of catching COVID than someone without it. So you talked earlier about how people with diabetes are at no greater risk of catching COVID, but they might be at greater risk of severe infection. Is there any difference for people with type 1 versus type 2?
So because this new coronavirus was identified in December of 2019, we don't yet know, based on the available studies, if there is a difference in the type of diabetes. So if there's a difference between type 1 and type 2 in terms of your risk of getting COVID-19, and we also don't know if there is a difference in terms of how the virus affects people depending on the type of diabetes that they have. However, we know that age is a factor that greatly modifies your risk of having a more severe infection if you're older than 60. So that's, there are other risk factors, but again, the studies are emerging. And so at this point, what I would say is we don't know if there's any difference. And as far as we know at this point, there aren't.
Wonderful. Would you care to repeat that?
Yes. Então, em português, eu quero dizer, a pergunta foi se as pessoas com diabetes tipo 1 têm um maior risco de se infectarem com o vírus, ou se elas podem ter um maior risco de complicações decorrentes do vírus se elas tiverem diabetes do tipo 1. E até onde a gente sabe, os estudos ainda não conseguiram fazer essa diferenciação. Então, até o momento, o que se sabe é que o risco é que o tipo de diabetes não afeta ou a gente não sabe ainda caracterizar se as pessoas com diabetes do tipo 1 ou do tipo 2 têm um maior risco de se infectarem ou de sofrerem complicações mais graves. No entanto, a idade é um fator que modifica significativamente o risco de ter uma doença mais severa. Back to you, Kim. Mhm.
Thank you. This next question is perhaps for both of you, but I'll start with MP Dzerowicz. Eileen is wondering what folks who are living in your riding or anywhere else in Canada who may not have internet access or maybe don't speak English, how can they access resources to care for their diabetes? So MP Dzerowicz, what would you point your constituents to? And then maybe Maira, are there any specific tools that you might have in some of the clinics that you work in?
Sure. Well, thank you for the excellent question. But first, I want to say a huge hello to Maira for welcome. Thank you so much for joining us. And thank you for all the amazing work you're doing in our riding. Here at Davenport, Perth, you know, I mentioned the Portuguese community, but we have a very active Spanish community there, very Italian community there. We have members of the Caribbean community there. It is so multi-ethnic. I love that place. And thank you for all the help and support you provide there. If you don't have internet or access to it, it's okay. Most of our community organizations are actually doing phone calls. And so, you know, when I've called just about every single community center, so from West Neighborhood House to Davenport Perth to Abrigo Center, and all of them are providing services over the phone, and as well, any of the supports that the federal government is offering. So even if it's just emergency benefit support, those can all be accessed by telephone. So for the community centers, I know Maira in a minute is going to give some telephone numbers that are available in the community. But for my office, it's 416-654-8048. And so we have people who speak Portuguese, Spanish. We try a little Italian. I'm not so sure if we actually, succeed. But I just wanted to say that. So there are, please do not say, oh, I'm not able to access. Yes, a lot of stuff is moved online. Often the libraries are open, but they're not open right now. But a lot of things are accessible right now by phone. So, do not be shy to go after the help that you need. There's tons of supports out there. And just one more thing, one of the things I've realized about our amazing community is just how many people are available to help. You just have to reach out and ask for it.
Wonderful, thank you. Renan, can you echo MP Dzerowicz's comments?
Sure. So, uma das nossas perguntas de hoje, que nós acabamos de receber, é como as pessoas que não têm acesso à internet ou talvez não falam inglês, como eles podem ter acesso a mais informações referente ao que está acontecendo neste momento com o coronavírus, né? Então, a nossa MP, a Julie, ela respondeu que muitos dos nossos centros comunitários, principalmente na área que ela tem a representatividade, eles falam outras línguas. Então, que nem um exemplo é no escritório dela, as pessoas falam português, espanhol, podem até tentar falar um italiano. Então, eles estão lá para ajudar a quem precisar. E mesmo se você não tiver contato com algum MP que representa a sua área, os centros comunitários, eles têm pessoas lá que falam a sua língua. Então, onde você mora, você só precisa procurar um centro comunitário e lá eles terão a oportunidade de poder te ajudar em qualquer dúvida que você tenha, em qualquer situação.
Great. Maira, maybe if you have anything to add to that, you can build it into your answer to this next question. Tom's wondering, he's living with diabetes, and he's checked out the online resources and online assessment tools for COVID-19. And they're saying even if he doesn't have COVID, he might need to distance himself even from his family and stay home. Is that consistent with the advice that you are offering your clients or patients, Maira? MP Dzerowicz, you might want to chime in afterwards, but we'll start with Maira. Does he need to be staying home, or does he just need to be taking the precautions that others are taking?
So thank you for your question, Tom. So what we are advising people is that to again continue to practice all the public health recommendations of washing your hands, using a hand sanitizer again, face covering, and keeping a distance from other people. What we continue to encourage people to do with diabetes or not is to maintain the social distancing as well. So you don't need to do a complete isolation at home, unless you have symptoms that are suggestive of the coronavirus, in which case you should seek testing to confirm if that's the case. So unless you are experiencing symptoms that may indicate that you have the coronavirus, you don't need to do a complete isolation. You can still continue to go out, but we encourage you to limit your contact to the people who are living with you, just because with the coronavirus, we don't know who can be infected, just because there is a gap between infection and having symptoms of the virus. So if you are in contact, let's say, with a family member who doesn't seem to be unwell, they could still be carrying the virus and transmitting that to you from being in close contact less than 2 meters away from you, and you will only know that later. So that would be my advice to him. But continue to do things like go out for your physical activity and to do things that help you to stay well, but still practicing those public health measures.
And wear a mask. One of our viewers is wondering,
yes.
should we be wearing, okay.
Yes, wear a mask to protect yourself and to protect others. Again, because not everybody who is infected with the coronavirus will necessarily be displaying symptoms early on.
Great, thank you.
So agora, can I just translate to Portuguese? A pergunta foi se uma pessoa que tem diabetes, ela deve fazer um isolamento total da sua família, entendendo que talvez mesmo que pessoas não estejam necessariamente doentes. Então a recomendação é que continue a praticar as medidas de saúde pública, evitando contato a menos de 2 metros de pessoas que não vivem com você, porque o coronavírus ele tem uma característica de que a pessoa pode estar infectada sem mostrar nenhum sintoma. Então vamos dizer que você encontra o seu familiar e conversa com ele, mantém uma distância de menos de 2 metros, ele pode estar transmitindo o vírus para você sem você saber. Então usar uma máscara, continuar a higiene das mãos e mantendo essa distância. São as recomendações, e fazer coisas que ajudam você a se sentir saudável e também fazer coisas que ajudam a relaxar, mas observando essas recomendações. So back to you. Thank you, Kim.
I'd add something. I think, see, there's a little bit of and I don't know if all the websites are up to date around this, but I think we're encouraging a lot more testing right now as well. And I think that if for some reason you feel you might actually, you're a little worried you might have it, or your family members that you think might have it, I actually would encourage people to go testing, to go get tested. I think that it would put a lot of people at rest. It doesn't mean that in this one moment you might get a negative test back. You still have to continue with your, with all the public health directives, even after that, because you want to continue to be negative as you move forward. In terms of family members, it's a question we get quite a bit. It's very difficult when you're in a house to be physically separated from the people that you're living with. So their families do different things. And I think that some families they say, this is our bubble. We are going to follow very strict rules when we leave the house. So everybody walks in, they have to wash their hands. Everybody walks out, they have to wear a non-medical mask. And so people have some strict rules. And again, they keep it within a small bubble. There are those who separate themselves out within their house. So for example, my mother, she's old, she has COPD. So she's someone who smoked for too long. And so her lungs are not very healthy. But in my mom's house lives my sister who works at a hospital, high risk. And my nephew who works at Loblaws, high risk. So they have to take some extra precautions because they would have to be tested almost every week or every few days to make sure that they're kept safe. So there's protocols at work. So there's some extra protocols that they keep in the house. That's not the same for every family. So I think that just because I do think that this is now, we're into our 13th week, so this is the end of our 12th week now. it's very hard not to be, when you're living with your family, not to be with it, particularly if you're not working, you're living from home. So I just say that there are some additional steps that I would say that if you have family members that work in certain professions, so my brother, by the way, works as a TTC driver, again, another high-risk profession, you know, there has to be some extra steps, and all the steps that Maira had mentioned is very important. And I would also encourage everyone to absolutely do, like, when you're going outside, it's okay to walk, but please make sure you have to wear a non-medical mask. You know, you have to wash your hands the minute you walk into the house. Keep as much of your distance as possible. And if you feel sick at all, don't go out. Do not go out if you feel sick at all. So you have to sort of stay at home, and those are kind of the main things. And I just add to that, we are encouraging testing. So if you've not been tested, you're worried, there is a local center near you. And I don't know if we have I actually don't know where the local center is, so I should probably know that. And I'm hoping maybe one of my staff who's actually listening in on this might be able to sort of send that over to me. But I do think that's something we should be advertising for the Davenport community. So thanks.
Thank you. Renan?
Sim, bom, a pergunta que nós recebemos, a Maira já falou, e a resposta da MP Julie, ela disse que ela gostaria que sugerir que, se você tem os sintomas, que você faça os testes. E ela acha que isso também vai tirar um pouco da preocupação de muitas pessoas que talvez tenham algum sintominha e já ficam desesperadas pensando que já tem o coronavírus. Então, ela sugere que, se você tem os sintomas, você deve sim procurar um centro e fazer os testes para o coronavírus. Isso vai ajudar você a tirar um pouco do peso da sua cabeça e toda a preocupação. E ela deu um exemplo também, dizendo que uma parte da família dela, como a mãe dela, tem uma condição de fumante por muito tempo, então isso pode agravar caso seja contraída a doença. A irmã dela também, que trabalha no hospital, então eles estão sempre fazendo uns testes para verificar se ela contraiu ou não no hospital. O irmão dela também trabalha no transporte público de Toronto, então é mais um trabalho de risco, que também há uma alta contaminação, um alto risco de contaminação para o coronavírus. O sobrinho dela também, que trabalha no supermercado, então eles estão sempre fazendo todas as práticas de higiene pessoal, como lavando bem a mão, quando eles voltam de casa, sempre fazendo a higienização. E se eles também querem andar, ou se vocês também querem fazer uma caminhada ao ar livre, não há problema, mas nós precisamos nos proteger, usando máscaras, assim que a gente voltar de casa, da caminhada, sempre manter 2 metros de distância na rua. Quando voltarmos para casa, nós temos que nos lavar as mãos, higienizar, se possível até tomar um banho também, para eliminar todo e qualquer possível foco de infecção. Mas o que é mais importante mesmo é manter as práticas de higiene pessoal.
Fantastic. Thank you, Renan. So Maira, we've got a few more questions, and I'm wondering if you can perhaps fold your answer to these questions in with any tips that you might have for how those of us with diabetes can care for ourselves while we're in this period of physical distancing and or access healthcare even when we're required to be remote. So one question is from Peter. He's just wondering if there's any difference between people with diabetes who are insulin dependent versus non-insulin dependent relative to the coronavirus. Is that a factor for contributing to the risk of developing infection? And then the other question that we have is from a teacher who's living with diabetes and wondering if it's safe for her to be in the classroom. So how would you respond to those questions, and what tips would you offer for people with diabetes on how they can care for themselves, especially right now?
Okay, so beginning with the question about what if being on insulin versus being non-insulin dependent modifies your risk for coronavirus infection and the severity. We don't yet have that kind of information. We don't have the breakdown to that level in order to make any kind of assertion in that regard. However, what the data is that's coming out seems to suggest is that how well managed your diabetes is a determining factor in the severity of the COVID-19 infection if you did develop the COVID-19, if you did become infected with the virus. So what we encourage our clients to do is that although many clinics are limiting the number of in-person appointments that are available, it's still very much possible, and it's highly advisable for you to continue to be connected with your primary care provider, so be it your family doctor or your nurse practitioner and your diabetes care team. If you are on insulin, there are very important steps that you can take to know when you should be monitoring your blood sugars more closely. If you are experiencing symptoms that may suggest that you are feeling that you're unwell to the point that you may be at risk, for example, of diabetic ketoacidosis, then you should definitely check your ketone levels. But you should, if you feel that you may be in a situation where you're worried about having diabetic ketoacidosis, you should definitely present to the emergency center at your hospital. So keeping your blood sugars well managed, but also having a plan for sick day management, so knowing which medications you need to adjust if you're feeling unwell, knowing when you should seek emergency medical assistance, and most definitely staying connected with your healthcare team via telephone visits or video visits, which the majority of clinics are offering. So continuing to manage your diabetes well, and staying connected with your team. And if they're not able to speak with you immediately, all the centers that I am aware of and that at the West Toronto Diabetes Program we're working with, we've been able to continue to provide services to our clients, including advising them, for example, when they should do new blood work or make any changes to their insulin regimen. So I'm going to now say the question and the answer in Portuguese. A pergunta foi se as pessoas que usam insulina versus que não usam insulina, se elas têm algum risco diferente em relação ao coronavírus, e além disso, o que pode ser feito para manter os cuidados de saúde, entendendo que muitas clínicas estão com um atendimento reduzido. O que eu quero dizer é que ainda não se sabe se o tratamento com insulina ou sem insulina determina algum risco diferente em termos de infecção ou de severidade do coronavírus, mas o que parece, com base nos estudos que estão disponíveis no momento, é que o bom controle dos açúcares é um fator determinante no risco de ter complicações ou da severidade da doença. Então, o que eu encorajo os pacientes é a terem contato frequente com seus médicos e sua equipe de cuidado com diabetes. Muitas clínicas estão fechadas, sim, para visitas em pessoa, mas que é possível continuar acessando os serviços por telefone e saber quais os medicamentos que precisam ser mudados no caso de alguma doença, e se for alguma situação de emergência, que sim, que eles busquem um atendimento médico de emergência. Over to you, Kim.
Thank you, Maira. Now, if it's okay, I'd like to just take a few moments to speak to some ways that Diabetes Canada is working a bit differently, trying to support people during the pandemic. And I've got a few great questions that have come in that I'll answer as part of these remarks. So I want to first reassure our viewers that now more than ever, Diabetes Canada is here to support our community of people affected by diabetes. We know that many of you are worried, you're looking for answers and resources, and we're doing what we can to meet those needs. We are offering more virtual tools than ever. We have a weekly video series that we air on social media and also put on our YouTube channel. That's called Ask the Experts, where you send us your questions and we find expert healthcare providers across the country who give video answers to them. we're offering supports, as Maira mentioned earlier, through our 1-800 Banting line or through info@diabetes.ca, where you can reach out for questions that you might have about programs that you can access, whether they're financial supports in your province, how to access the disability tax credit, or other questions. We also are just as of a few weeks ago, through that telephone number, we're offering our diabetes education line, where you can phone and ask a question related to your personal diabetes management, and you'll be contacted by a volunteer diabetes educator, someone very knowledgeable like Maira, who can speak to you about your specific questions and concerns. We are offering a website, as Maira also mentioned, at diabetes.ca/coronavirus that offers information about the link between diabetes and COVID-19, as well as answers to some frequently asked questions. We're working on plans to bring a number of virtual conferences to the community through the year. There will be one for people with type 1 in September. There's going to be some other fun activities where we can all lace up together for diabetes and get active, as well as learn about diabetes and raise awareness in the community. That'll also take place in September. And we're just doing things like this webinar to offer you information and to stay connected to you and your concerns. Another important thing that Diabetes Canada is doing during this time, as we always do, although it's a bit different and more specific to COVID right now, is we are advocating for the needs of people with diabetes on a number of fronts. And so one of the questions that we had from Tom, our viewer, was around the fact that pharmacies have changed their practices in recent months, so that whereas they used to dispense 90 days of a prescription at a time, they are now typically dispensing only 30 days at a time. And that can affect those of us that are taking insulin or other prescription medications regularly, in terms of meaning more trips to the pharmacy. We at Diabetes Canada know that that's been a concern for a number of people with diabetes. The reason that measure was put in place was to make sure that there were no limits to the availability of insulin overall. We wanted to make sure, the government wanted to make sure that everyone in Canada who needed insulin and other medications could get them. And in the very early days of this pandemic, when we were getting organized, there were concerns about some shortages that was a response to. Diabetes Canada has been working closely with Health Canada and with the Pharmacists Association to make sure that there have been no drug shortages. Any sort of disruptions were very, very temporary and localized. And one of the things that's helped make that possible is that change from 90-day dispensing to 30-day dispensing. But increasingly, we're seeing two things happen, which are great. One is provinces are increasingly encouraging their pharmaceutical associations to waive the multiple dispensing fees that can bring. And the other thing is a number of pharmacies are starting to be able to relax some of those practices depending on supply. So I think we'll start to see that ease up, but that's something that Diabetes Canada, as well as our partners, Health Canada, the Pharmacists Association, are staying very close to. Another concern that people have is with respect to employment. We know we've had a lot of questions and outreach from people with diabetes who are wondering if it's safe for them to return to work as economies are reopening, wondering if it's safe for some people don't live with diabetes themselves, but care for those who do or live with those who do, and they're wondering what they can do to return to work safely, or whether they can take a leave of absence. And I'll ask MP Dzerowicz to weigh in just a moment, but I think that Diabetes Canada's advice has been certainly work with your employer where possible to find a solution and an accommodation that can help you. And Diabetes Canada has made a letter available on our website, diabetes.ca/coronavirus, that you can download and print and bring to your employer, just to familiarize them with some of the increased risks that you may be facing by virtue of living with diabetes, and to encourage them to be as flexible as possible in working with you to make any accommodations. MP Dzerowicz, did you want to add to that?
Sure. Here's what I'd say is, I had mentioned in my opening remarks that there's a great website, www.canada.ca/coronavirus. And if you just scroll down just slightly, there's a section that's called, I believe it's Your Health. And basically you click on mental health and wellness, and it actually gives you a number of resources that I think is very helpful to people. So whether it's mental health, whether it's just how to eat well, how to keep yourself safe, I think there's a number of resources that I think is just good. And there's also links that send you down to the provincial level as well. So I think it's just important to know that in general. In terms of just your workplace and keeping it safe, so this is under provincial jurisdiction. I will tell you, we say, our Prime Minister says this all the time, do not return to workplace. Like, your employer, their responsibility is to make sure that it is a safe workplace for you. So the Ontario government does have a phone number that you can call if for some reason you are worried about, for some reason, your workplace not being safe. But I would say to you that my sense is that all the provincial leaders, so our Premier and his team, is very concerned about, how do we reopen the economy slowly, cautiously? How do we do it in a way that keeps everybody safe? Our Prime Minister over the last couple of days has been talking about making sure that everyone has access to the personal protective equipment they need, so the masks that they might need, anything that's going to keep them safe in their workplace, and to make sure that we have enough testing capability. Because when you have more people going out into the public, going more back to work, we need to be doing more testing to more of the population, okay? And so it's testing and contact management. That means if for some reason we do find a positive case, we actually contact everybody that person's been in contact with. So we've really pushed up those numbers to make sure that as we're reopening the economy ever so cautiously, ever so slowly, that we continue to do everything we can to keep Canadians healthy and safe.
Great. Thank you. Renan, would you care to summarize maybe what we just said?
Good luck.
Thank you. Let me just get here. Então, a Kim, ela entrou em um bloco agora onde ela está fazendo algumas anotações e algumas recordações do que tem sido falado até agora. E tem uma pergunta do Tom, que ele falou que algumas farmácias, elas estão mudando a política de 90 dias de medicação para menos, para possivelmente 30 dias, o que tem feito que eles tenham que ir às farmácias por mais tempo. Então, a Kim, representante do Diabetes Canada, ela disse que ela, junto com a companhia, com o Diabetes Canada e o governo e os líderes provinciais, eles estão trabalhando em pedir que esses farmacêuticos estejam mais flexíveis quanto a isso, para que não haja um alto índice, talvez, de proliferação do vírus, o que aumentaria o número de casos de coronavírus também. Ela também disse que a Diabetes Canada, aqui no Canadá, eles estão encorajando que os líderes, let me just see here, just a second, em questão a voltar ao trabalho, ela também disse que eles estão fazendo de tudo para que seja seguro para as pessoas que tenham diabetes ou tenham a pré-existência do diabetes possam voltar ao trabalho com segurança. Mas se você não sente seguro, nós temos algumas informações no nosso website diabetes.ca, a diabetes.ca/coronavírus, e lá tem algumas informações que você pode talvez imprimir ou então encaminhar para o seu empregador referente a isso. Talvez você não tenha diabetes, mas você tem alguém na sua família, na sua casa que tenha diabetes. Então, isso pode talvez agravar a situação dentro de casa, caso você traga o vírus para dentro de casa sem saber. E a nossa MP Julie, ela também enfatizou que tem um site do Canadá, que é canadá.ca/coronavírus, assim como ela mencionou no começo da apresentação dela, e lá também tem muitas informações que podem ser levadas e adquiridas, e você pode entender um pouco mais do que o governo e todos os líderes federais estão fazendo para conseguir fazer com que as províncias se reabram, os trabalhos podem se reabrir, os offices, os escritórios, e toda a economia possa voltar ao normal. Então, existe uma preocupação de que todo mundo possa ter os equipamentos de proteção, como máscaras, como hand sanitizer, como a proteção, o teste também. Então, eles estão trabalhando muito focado nisso, que assim que as províncias se reabram para o comércio, que eles possam ter todos os suprimentos em ordem para que todo mundo possa se sentir seguro ao sair de casa para trabalhar ou que para fazer qualquer outra coisa que há necessidade ou importante para o convívio deles.
Wonderful, obrigada. Now, I see that we're really almost out of time. I'm going to pose one more quick question, if I may, and then I think we'll wrap up. But this question's a great one, and MP Dzerowicz, you might have a great answer for it. I'm going to give a partial answer just before I throw to you, but here's the question. From Allison, our viewer, today the government announced a one-time COVID-19 payment for Canadians with disabilities. Who receive the Canada Disability Tax Credit. However, it seems that many Canadians with diabetes, type 1 specifically, do not qualify for this. This is despite the very high costs, some of which are offset by the Assistive Devices Program in Ontario. What will the government do to help Canadians with diabetes offset these costs, especially as many people are living on lower incomes or out of work at the moment? So, awesome question, Allison. The Disability Tax Credit is a program that Diabetes Canada has been really active in working to ensure access to for all Canadians. And the government's been doing some excellent things in the last couple of years to make it more available to Canadians with all sorts of diseases and conditions, including they created a Disability Advisory Committee back in early 2018, whose recommendations actually were released a few months ago and included that everyone with type 1 diabetes should automatically qualify for the DTC. So we would love to see that implemented. That's going to take some time. But in the meantime, I know that about 55–60% of those adults with type 1 who apply for the disability tax credit, whose doctors or healthcare practitioners certify that they meet the criteria, are able to access it. So do consider talking to your healthcare provider about applying. And Allison, I'll email you some information. If others of our viewers have questions, visit our website or contact me. But MP Dzerowicz, can you talk about that one-time payment and any further comments you would add about how Canadians with disabilities can defray these extra costs?
Sure. Sure. Thank you so much for that question. I will tell you, the one day that I haven't seen our Prime Minister on TV is today. The one day.
Isn't that always the way?
So I'm just like, oh, of course. So first of all, here's what I'm going to say. I am delighted that we are sending $600 to Canadians, to some Canadians, so I think a target group of Canadians that are experiencing disabilities. And what I'm seeing online is basically that it's going to those who receive, as you mentioned, the disability tax credit. So look, here's what I'm going to say in general, because it sounds like from what Allison's perspective, those with diabetes isn't currently going to be accessing it or be eligible for it. Here's what I say to you. Everything that we've done as a federal government to date has been about emergency support. So it's like urgent, immediate support. Why? We know that many people have lost their jobs. We know we've needed to provide money for Canadians to actually stay at home and keep themselves safe, okay? And then we knew that for every group, we needed to do a little bit extra. So for seniors, we've announced some additional one-time payments for the GIS and the OAS that's coming out the week of July the 6th. We've announced that because we know that seniors, they're not able to take the TTC right now. They've got some additional costs. They're not able to go to the local grocery store. They've got some extra costs. So, you know, we've been, you know, we as MPs have been talking to our Prime Minister, our cabinet members to say we need some additional dollars for seniors. We needed some additional dollars for youth. Youth don't have access to, one, they couldn't finish their school year properly, and they don't have access to all the student jobs that they need to be able to afford their university next year. So we provided some additional supports to them. Our minister, Minister Qualtero, she is in charge of those with disabilities and exceptionalities in our country. She's created a committee to look very deliberately on how we provide some additional supports to those who have some disabilities. So I think, my opinion, this is a one-time tax-free payment. It's targeted to a particular group of of Canadians who have disabilities. It's to provide some additional funding for those who just, everything's just more expensive now and people can't get around the way they usually do. But I want to let people know, if you have, Allison, if you feel you have there's some additional cost, there's an additional need for additional funding, make sure that you are talking to people like me, your local MPs. The only way we know that there is a problem or there is a need out there is if you're actually talking to your members of parliament. And so that's the only way that we can actually help address your issues. One, there actually could be some supports that are already out there that you might not know. That's one. And then two, if there's a specific, like there's a big expense that we just didn't know about, then we need as a government to know, to see if there's anything we could do to address it. So I just say, first, thank you for raising the question. Two, please make sure that you are reaching out to your MPs or leaders such as Kim, who heads up Diabetes Canada. She's very much in touch with people like you know, me or other MPs, and it's important for us to continue to be pushing to make sure that we have the supports that we need moving forward. So thanks for letting me answer that question. I do have to go though, so we'll have to sort of wrap up if that's okay.
Of course.
I'm not sure if we have to sort of translate that. I mean, the bottom line is basically, you know, I would say there's going to be more information around the disability tax credit, the 600. If, you know, the way our government works is we're putting things out a little bit at a time, depending on what we see are the needs. And I would just tell people to make sure that they are connecting with their local leaders, local politicians, to make sure that we are aware of what the needs are locally.
Well, thank you, MP Dzerowicz. I think that's a great point, and I think I will take your cue. We'll wrap up now, but I'm sure that you would welcome any of our viewers who are your constituents and have questions about federal matters to contact your office. We at Diabetes Canada would love for you to contact us at info@diabetes.ca or by our 1-800 Banting number. We really hope this has been a useful source of information for you, and please be well.